All right. Hi, everyone. Welcome. Hopefully you guys can all hear me. Thank you for joining us today for the webinar, Genetic Counseling, the Career for You. My name's Amber, and I'm joined today by two other genetic counselors, Megan and Sarah. Just a few housekeeping items before we get started. You guys are all in listen-only mode. If you do have questions, please feel free to type them into the question box, as we will be having a Q&A at the end of the webinar. All right, so an outline about today's webinar. We're going to talk about what is a genetic counselor and genetic counseling. Why would someone want to become a genetic counselor, as well as the educational path on how to become a genetic counselor. So a little bit about myself. I grew up in Canada, and I attended the University of Manitoba, where I received my undergraduate degree in genetics. After graduating, I moved to Minnesota, and I attended the University of Minnesota for my master's degree in genetic counseling. And after graduating in 2016, I moved all the way down to Dallas, Texas. And this is where I currently work as a cancer genetic counselor at the UT Southwestern Medical Center. So let's start off with what is a genetic counselor. So a genetic counselor refers to a healthcare professional who has specialized education and training in both genetics and counseling. And that means that they received a master's degree from an accredited school. And genetic counselors are the healthcare professionals that provide personalized support relating to individuals' genetic health. And this is the definition that's provided by the National Society of Genetic Counselors, which is the leading voice for genetic counselors. Now, genetic counseling refers to the actual process. And so this is the process of helping people both understand as well as adapt to genetic conditions or genetic risk. And it involves not only the medical aspects, but also the psychological implications and how this affects an individual and their family. Now, there are several goals of genetic counseling, but I want to highlight kind of three main goals here. And one of those goals is to help patients and family understand complex medical information. The other is to have your patients actively participate in the decision-making process. So we know that genetic testing is a very personal decision and it carries several emotions. And so genetic counselors are often in a position to help guide patients to reach a decision that is right for them. And then also to help patients and families adapt to a genetic condition or risk in the context of their family and cultural situation. Now this here just shows some components of a genetic counseling session. Now genetic counseling was traditionally thought of as occurring face-to-face or in person. However, there has been an expansion in the delivery of services. So some genetic counselors may provide telephone or telemedicine genetic counseling. And this really has expanded access to genetic counselors by allowing those that live in rural areas or have barriers to reaching a large medical center, the ability to access these services. Some people are also providing genetic counseling in a group setting. Now, genetic counseling can kind of be broken into pre-test counseling as well as post-test counseling. And in the pre-test counseling, essentially we're discussing with the individual or the family the reason for referral, so why are they coming into clinic. We're reviewing their medical history as well as their family history. And the family history is really key. So genetic counselors are trained to take a very detailed and targeted family history for the indication at hand. We also then perform a risk assessment. So what's the likelihood of a genetic condition or recurrence of a condition in a family? And then discussing genetic testing options. If an individual decides to move forward with genetic testing, then the post-test occurs when we are reviewing those results with them, discussing prevention and management options. And throughout this entire process, both pre-test and post-test, genetic counselors are there to provide emotional support during what can often be a challenging and confusing time. So this slide here presents from some data from the most recent professional status survey of genetic counselors. And so on the right-hand side of the screen, you'll see genetic counselors can work in a variety of settings. So most genetic counselors that are seeing patients are likely going to be working in a hospital setting. However, there's genetic counselors that work in universities, so they may be involved in academics and education. For example, those that are teaching or medical directors for genetic counseling programs. We also have genetic counselors that work in clinical testing labs. Now, these genetic counselors are not performing bench work, so they're not in the lab, pipetting, doing PCR, but they're essentially involved with writing and interpreting test results, answering questions that physicians or other genetic counselors or patients have. Genetic counselors can work for nonprofit or government. They can be involved in the public health setting, as well as even working for health insurance companies. Now, on the left-hand side of the slide, you'll see all different specialty areas that genetic counselors can work in. Now, genetic counselors, when they go to school, they are trained in all of the core specialty areas. And so some genetic counselors may practice in just one specialty area, but there are genetic counselors that may practice in multiple specialty areas. We'll talk a little bit more about these specialty areas in a couple slides. So let's look at some of the roles of a genetic counselor. Genetic counselors can have multiple roles, but I want to kind of highlight three main roles here. So the first being the clinician. So this is when the genetic counselor is typically working with patients and families, gathering that medical and family history, performing the risk assessment, providing information about genetic testing and explaining those results, as well as developing that personalized medical plan. But we also wear the hat of patient advocate. We're there to provide support to our patients, short-term counseling, as well as to connect them to any necessary resources or support groups. And then we also wear the hat of an educator. So part of the genetic counseling process is educating our patients, but genetic counselors are also involved in educating students, other healthcare professionals like nurses, doctors, physician assistants, as well as the general public. And genetic counselors work as part of a healthcare team. And depending on what specialty you work in, you may work with different healthcare professionals, but these can include things from physicians, nurses, nutritionists, occupational and physical therapists, to sonographers if you're working in a prenatal setting. All right, so let's move into talking about some of these specialty areas. So the first area that we're going to talk about is prenatal. So individuals that may see a prenatal genetic counselor include individuals or couples who are pregnant or planning to become pregnant. And listed here are some common reasons they may come into the clinic. So one being advanced maternal age. So we know that as parents get older, there's an increased risk for chromosome abnormalities, such as extra chromosomes that can cause, for example, Down syndrome or certain single gene disorders. Individuals may be coming in because they have an abnormal screening result or an abnormality found on an ultrasound, or maybe there's a family history of a genetic condition. And so in prenatal genetics, there's a lot of screening tests that are offered. So blood screening tests to evaluate the risk of a chromosome abnormality, ultrasound screening, which can look for abnormalities that may be suggestive of a genetic condition. However, in order to confirm a diagnosis in pregnancy, diagnostic testing is required. So this could be a CVS or an amniocentesis. The CVS involves removing the chorionic villi from the placenta for testing, and amniocentesis involves removing some of the fluid that surrounds the fetus that contains the fetal cells. And in some cases, individuals may come in prior to becoming pregnant if they either have a family history of a disease or if they're concerned about the risk for a certain genetic condition. And some families may choose to go with pre-implantation genetic diagnosis. So this is when fertilization occurs outside of the body, and those embryos can be tested to determine if they have a specific genetic condition. And then those embryos, for example, that maybe do not have the genetic condition, may be the ones that are implanted. All right, so now let's look at both pediatric and adult genetic clinics. So the pediatric genetic counseling clinic is for individuals that are under the age of 18. A couple common indications. So one would be an abnormal newborn screen. So newborn screening is a public health program where all newborns are tested for genetic conditions that can cause serious health problems early in life, but where early intervention and treatment can show a huge benefit and actually prevent some of these life-threatening illnesses. They also see children that have developmental delay, failure to thrive, or dysmorphic features. The adult genetic clinic is just for those that are over the age of 18. So this could be any adult with a genetic condition, of a family history, for example, of Huntington's disease, or a family history of other genetic conditions. All right, so now let's talk about the specialty area of cancer. So this is the area that I work in. And so in a cancer clinic, you could see individuals that have a diagnosis of cancer or are unaffected and have a family history of cancer. And essentially, you're doing genetic counseling and testing to determine whether or not they have an inherited increased risk for cancer. And so there's certain features that we look for that can make us more concerned in our risk assessment for a hereditary predisposition syndrome. So an early age of diagnosis for the cancer under 50, having multiple or bilateral cancers, cancers that we know can be linked. So for example, breast and ovarian cancer, seeing the cancer in multiple generations, or rare cancers in the family, for example, a male with breast cancer. Next, we'll talk about those genetic counselors that work in the laboratory. One thing to know with laboratory genetic counselors is some of them actually work in the physical labs, the commercial labs where they are located. However, there often is the ability to work from home for several laboratory genetic counselors. But they work with the genetic counselors that are in clinic, the physicians, as well as clients or patients. They're involved in communicating and clarifying genetic test results, helping to identify the best approaches for testing. They may be involved in writing the laboratory reports that the clinical genetic counselors or physicians will receive. And then let's talk a little bit about the research genetic counselor. So many genetic counselors are involved in research in some capacity. However, some genetic counselors may spend more time involved in clinical research. So they may be coordinating and recruiting enrollment of individuals and families into studies, walking them through the informed consent process. They may be involved in grant writing to try and secure funding for these research studies. And the list kind of goes on. There's several other specialty clinics. So there is cardiology, cystic fibrosis, psychiatric genetic counseling, neurogenetics, pharmacogenomics, essentially looking at how someone's genetics affects their ability to respond to a drug. So a little bit about a day in the life of a genetic counselor. So most genetic counselors work kind of that 9-to-5 type job. They typically are not working shift work, but they have many responsibilities and perform a wide variety of tasks. So several genetic counselors are involved in seeing patients, where they likely spend a good portion of their time. They spend time making phone calls, so whether they're chatting with patients or the testing laboratories, insurance companies, healthcare providers. They're involved in ordering genetic tests, documenting their encounters, so the initial encounter, sending result letters or family letters to patients. Again, often involved in some capacity to research. A lot of genetic counselors are involved in education, so developing educational tools or presentations that may be for patients, but maybe for students or for the general public. And then a lot of genetic counselors have the pleasure of supervising learners in clinics. So we get to supervise those genetic counseling students. All right, so let me just switch over here, and we're going to have Megan take over next.
All right, you guys, so now that you heard a bit about the type of roles genetic counselors can fill, my goal is to convince you to become one. But first, some background about me. I did my undergraduate at Texas A&M University in College Station, and I double majored in biochemistry and genetics. I graduated from there in 2014 and then immediately went into grad school at the UT Genetic Counseling Program. Graduated from there in 2016 and have since been practicing as a prenatal genetic counselor. And I'm currently doing that with the UT Health Program. I'm also working as a coordinator of recruitment and outreach for the UT Genetic Counseling Program. And I also serve teaching, mentoring, and supervising roles for the program as well. So genetic counseling used to be a hidden gem in the healthcare field, but it's since gained quite a bit of recognition, and rightfully so. The profession was named one of the top 25 amazing healthcare support jobs in 2017, and has since been on the list for 100 best jobs for several consecutive years. At this time, there's also quite a bit of job security. The profession is growing at an above average rate, and most graduating genetic counselors have secured a position before graduation. The salary is also relatively competitive. This can fluctuate depending on your location or your specialty, but the average salary in 2018 was over $96,000, which is quite impressive. Additionally, a vast majority of GCs have satisfaction with their job, which is very important. A unique feature of the genetic counseling profession is that a single board exam will allow you to practice in any specialty, which allows for flexibility and can also help minimize fatigue. So if at any point you're ready to try something new, you can switch around and do so easily. You're also considered an expert in genetics. So many physicians know basic genetic concepts or basic information about available testing options. But as a genetic counselor, you're often the one who is responsible for guiding that part of a patient's care. And having this level of autonomy while still working as part of a larger team can be pretty fulfilling. And of course, given the nature of the job, the emotional satisfaction you receive from helping others is quite incredible. So hopefully at this stage, we've convinced you that this is the right career path for you. So the next step is to consider how to join the field. One thing to consider, and you may have gathered this after hearing Amber discuss the roles of a GC, is the type of qualities that make a successful genetic counselor. Generally, genetic counselors have a background in some type of science or some type of psychology, and really a desire to merge the two. They generally have experience and a passion for counseling and working with people who need help. And as an extension of this, generally are effective listeners and communicators. Most genetic counselors also have a desire to keep learning even beyond their graduate education. So if this sounds like you, here's what you do. First, you achieve a bachelor's level education in, like I said, some type of science or social science. However, many of our students have come from various other backgrounds that have served them well in the genetic counseling program and profession. For example, we currently have a communications major in one of our second-year classes. But then you must obtain a master's degree from an accredited program, and we'll talk about what that means in a little bit. And then finally, you must pass a board examination. You typically get 3 attempts to do this. And in Texas, the genetic counselors do not currently require licensure, but other states do. Really, this is just an extra set of paperwork that can be state dependent, but it's not incredibly difficult to leave the state of Texas and go to another state requiring licensure and get that completed afterward. So thinking about prerequisites, most genetic counselor or genetic counseling programs require the following courses, but it can vary from program to program, especially with varying emphasis on what is required versus what is just strongly suggested. At this time, most genetic counseling programs do require that prospective genetics counseling students take the GRE, but right now this is kind of an evolving part of the requirements. Some programs are starting to waive this or just look at those scores differently. So if you're at the stage where you are considering applying and investigating different programs, I would encourage you to look into their specific requirements for the GRE because it can be different from school to school. As of now, the UT program is requiring all students to take the GRE, and Baylor is as well, but that is up for debate and change. All 3 scores of the GRE are important, and we do like to see at least a 50th percentile or average, but most students will have an average of the 75th percentile in each of those 3 scores. Additionally, a GPA of 3.0 or higher is considered competitive, but most students who matriculate do have a GPA of 3.5 or higher. At this time, you can find a list of accredited programs, meaning programs that have been evaluated and have satisfied very rigorous criteria by the Accreditation Council for Genetic Counseling. You can find that list on the ACGC website. And as of now, there are 45 programs across the US, 4 in Canada, and 3 are pending their accreditation process at this time. And they are found all throughout the country. We do have 2 programs in Texas, and both are located in Houston as part of the Texas Medical Center. The UT Genetic Counseling Program has been around since 1989 and trains students at various institutions, including UT Health, Memorial Hermann, and MD Anderson Cancer Center. At this time, the incoming class is expected to have 10 students, and we're thinking it's going to stay that way for the foreseeable future. So because these class sizes are on the smaller side, sometimes it is quite competitive, but some other schools are taking larger class sizes. All right, and we're going to turn it over to Sarah.
Wonderful. My name is Sarah Huguenard. I am very excited to be talking with y'all about genetic counseling this evening. As you can probably tell so far, most genetic counselors are very passionate about what we do. I work with the Baylor Genetic Counseling Program, the other program in Houston, so I will talk a little bit about that and then I will introduce myself to you all. So the Baylor College of Medicine Genetic Counseling Program is a more recent program. We're currently in our 2nd year, so we have for the first time a cohort of our 1st-year students and 2nd-year students. We received accreditation from the board that Megan mentioned last year in 2018. We are also located in the Texas Medical Center just down the street from the UT program, and we are housed in the School of Health Professions. Baylor is associated with Texas Children's Hospital, so our students also rotate through that hospital system. Currently, we have 8 students in each class, but this next year we're planning to increase our class size to 9. So we're planning to accept 9 students for next fall's new class. And here's a little bit of information about the 2 programs in Texas. You can see the websites listed here. If you have, we're going to talk a little bit more about graduate school, but if you have specific questions about the UT program or the Baylor program, please reach out to the program leadership through these websites. We'll provide additional contact information in just a few slides. So just to introduce myself to you all, I am originally from here in Houston. I went to undergraduate at the University of Virginia and studied biology and religious studies with a focus in bioethics, all of which have served me very well as a genetic counselor. I then moved back to Houston for genetic counseling school. I went to the UT program and have used the skills that I've learned there to help create the Baylor College of Medicine program and have had the privilege of being a founding faculty member here. I also currently practice in prenatal and cancer because I couldn't make up my mind, and I like aspects of both of those specialties. All right, so exposure to the field has become increasingly more important as the profession has gained visualization. We have more applicants. And so the classes have become increasingly more competitive. Something that we like to see from a program perspective is that you know what genetic counseling is and you know that you want to do it. So one way to be able to assert that is to talk to professionals in the field, reach out to genetic counselors in your area. And you may live in an area where there aren't too many genetic counselors, and that's completely fine. You may not know how to find a genetic counselor. So if you'd like to get started, I would suggest the easiest way is to go to the National Society of Genetic Counselors website, which is nsgc.org. There's a lot of information for prospective students about what genetic counseling is, how to become a genetic counselor, some of the things that we've highlighted here in this webinar so far. You can also contact a graduate program director or current students. You can usually find contact information for the program on individual program websites. There are also emerging positions called genetic counseling assistants. We'll talk more about these in just a moment. But genetic counseling assistants are individuals usually who are interested in becoming genetic counselors who assist genetic counselors in their daily activities that can look very different and really variable, but gives you great exposure to the field. As you're preparing to apply, one thing that's important to think about is advocacy experience. If you've been around hearing about genetic counseling for any amount of time, you've probably heard this term. The reason why advocacy experience is important to us in an applicant is because as a genetic counselor, we advocate for our patients. And that's a big part of what we do. So we like to see that you've had some training in interpersonal and communication skills to some degree. We like to see that maybe you've worked with the public in a one-on-one setting. Some ways to do this are volunteering with a crisis hotline service. These are very popular and easy to do at this time because there are a lot available through the telephone, through online, through texting. Others have worked with a pregnancy center, volunteered at shelters for domestic violence or for individuals who are homeless, really demonstrating that you've worked with people who are in need and in crisis is important and is helpful to show us that you have those types of skills. Look for support groups in your area, community outreach and volunteer positions, whether you're in high school and college or have graduated from college. See what's around you and be creative. There's no one right or wrong way to get advocacy experience, but really focus on experiences that give you opportunities to work with people during a crisis situation. I've alluded to the importance of talking with a genetic counselor and potentially shadowing, where you get to observe a genetic counseling session. There are some internships available. There are several in Houston at both Baylor and MD Anderson, I know. And then you can also find genetic counselors in your area through the NSGC website. The easiest way to find this is to either go to this URL here on the slide, or if you just Google NSGC find a genetic counselor. You can find a genetic counselor within 10 or 50 miles of you, and you can select what specialty you're looking for experience and reach out to them through that page. You might also be interested in gaining any type of research experience. This is not necessary to applying to genetic counseling school, but it might be helpful. Research experience might include research in a lab or clinical research, but that just strengthens your ability to demonstrate that research is something that you're familiar with and that you've worked with before. And then attending recruitment events. Most schools will have some type of in-person or online recruitment platform. Again, I would visit those genetic counseling schools' websites that you might be interested in. I know for the programs in Houston, both programs have an in-person session in August, And then the Baylor program has a webinar in October. So if you're thinking about applying, not for this cycle, but for next year, see those websites for recruitment event opportunities next fall. So I mentioned earlier the genetic counseling assistant. I wanted to give you a bit more detail about what this is. There's quite a variety of roles of a genetic counseling assistant. I have a genetic counseling assistant who works in my office with me. One of her roles is to review incoming referrals and triage them, making sure those referrals have all of the information that's needed, contact the referring offices for any documentation or test results that might be missing. And so that's a great opportunity to become familiar with the terminology used in genetic counseling. Genetic counseling assistants may also assist with obtaining family history information. One of the things that pretty much any genetic counselor does in most settings is to take a family history. And you'll see examples of that shortly here. And so sometimes genetic counseling assistants can gain experience and exposure to obtaining family histories. Genetic counseling assistants may also maintain the genetic counseling schedules or conduct laboratory or clinical research with genetic counselors. And many GCA positions also offer shadowing experiences. So we know that there are at least 11 genetic counseling assistant positions in Texas currently across a variety of settings, whether clinical or research or laboratory. So lots of opportunities in Texas to become involved through a genetic counseling position or genetic counseling assistant position. All right, so we're going to talk a little bit more in detail now about the process of applying to graduate school. Now that hopefully you've all decided that you'd like to apply, Megan mentioned some of the important aspects that are typically required for an application. So this is just a broad sweep. Again, please refer to a particular genetic counseling program's website for individual requirements, but most will require a personal statement, a number of letters of recommendation, GRE scores, transcripts, and a resume or CV. Important deadlines, most programs require that you've completed and submitted your application sometime between December and February. It depends and it varies based on the program's deadline. Most interviews take place between February and April. So once you submit your application, programs will select a certain number of applicants to come in person for an interview. And then the genetic counseling acceptance is on a match basis. So if you're familiar with the medical residency process, this is similar. But essentially what happens is programs will submit to the national match their top applicants following their interviews. And then accordingly, applicants will rank their top programs as well. And then the match will match them up. So applicants must submit their program rankings by midnight on April 14th of next year. And then match day, when you find out what program you're matched to, this year will be April 24th, 2020. In future years, we anticipate it should be in late April. That's generally the timeline. So to zero in a little bit more on the student experience of what graduate school is like. Graduate school, of course, will vary depending on your program, so we'll just give some general information here. But most graduate school experiences will include classes, clinical rotations, and a bit of research. So coursework typically focuses, of course, on clinical genetics, cytogenetics, meaning the types of tests that are performed, genetic tests that are performed, embryology to help understand how a fetus develops, which is important for prenatal genetics, molecular genetics to understand why certain genetic mutations cause certain genetic diseases, and then the psychology side of things. So psychosocial theory, ethics, and counseling techniques are important, especially because we're dealing with families and often talking about very complex situations and guiding families through difficult decisions and information. Students typically will have to give a variety of presentations, including presentations during weekly conferences. Clinical rotations will vary between programs, but most include exposure to all of the major types of genetic counseling in a clinical setting. And then especially for the, or at least specifically for the UT and Baylor programs, students have an opportunity to select elective rotations in those less common focuses of genetic counseling, such as research, industry, or specialty clinics. For example, a neuropsychology clinic, or a metabolic clinic, or a cardiovascular disease clinic. The research requirements also vary between programs, but most programs require some type of research project or a thesis project. Additional experiences that genetic counseling students have include shadowing procedures, which is pretty neat. Sometimes might include a colonoscopy or amniocentesis, or even fetal surgeries performed on a fetus before birth. Students will give presentations in front of doctors and other healthcare professionals at grand rounds and journal clubs. There are often opportunities for community advocacy, extracurriculars, attending the National Society of Genetic Counselors Conference, mentor-mentee events, and most programs include a teaching assistant opportunity in the medical school that it's associated with, or elsewhere. So many opportunities in genetic counseling graduate school aside from didactic classwork. Here are a few photos of the UT and Baylor genetic counseling students at Halloween events, Christmas events, lobbying in Austin for the March of Dimes, participating in a March for Science, students and faculty presenting their thesis research, and volunteering at the Rise School of Houston, which is a school in Houston who focuses on catering to children with special needs. So now I wanted to provide a few case examples so that you can see what types of patients are seen in the genetic counseling clinics.
All right, so first we're going to start with a cancer genetic counseling case. So here we have AJ. She is a 37-year-old female who is referred to for genetic counseling. She has no personal history of cancer, but she reports the following family history. So she has a mother with ovarian cancer who passed away at age 56, an aunt that's living but has a history of breast cancer, her maternal grandmother that died from ovarian cancer, and then a brother with no cancer history. And so we would collect this in the form of what we call a pedigree. So we would draw out the family tree, we'd get at least three generations, and in the cancer clinic, we're really focusing on types of cancer, ages of diagnosis. So we can see that we have the patient down here, the circle, the female, the square here is the males, and then we have the cancer history on her mom's side of the family. And so we know that about 10% of cancers are hereditary. And in this specific scenario, we're concerned about what's called hereditary breast and ovarian cancer syndrome, or HBOC. And this has to do with a genetic mutation in one of two genes, either the BRCA1 or BRCA2 gene. And if an individual has a mutation in one of these genes, they have an increased risk for several different types of cancers. So both males and females have an increased risk for breast cancer. Females have an ovarian cancer risk, prostate cancer for males, and then both males and females having an increased risk for pancreatic cancer. So if someone has a mutation in one of these genes, there are changes to their medical management. So increased screening, either increased breast screening or prostate cancer screening. It could be more frequently, or it could be beginning at a younger age. And in some cases, preventative surgery. So actually removing the breast tissue or removing the ovaries to reduce the risk of developing a cancer. And so in this particular case, the patient elected to undergo genetic testing and was found to have a BRCA1 mutation, which confirmed the diagnosis of HBOC. And in this particular case, the patient elected preventative surgeries to remove her breasts as well as her ovaries to help lower her cancer risk. And of course, we know that genetics has implications for family, which means that now, for example, her brother could undergo genetic testing to see if he also inherited the BRCA1 mutation. So, who is our patient, Miss AJ? This actually happens to be Angelina Jolie's family history. We know that Angelina Jolie has a BRCA1 mutation and did elect to have a double mastectomy to remove her breast tissue, as well as a surgery to remove her ovaries.
All right, so an example of a case I might typically see in the prenatal setting, this would be a 39-year-old woman who is in her first trimester, around 13 weeks gestation, and she is referred to genetic counseling because of some abnormal screening. Now, most of the time, or I guess I shouldn't say most, but at some practices, we have the privilege of working with patients prior to electing testing. So they are involved in that informed decision-making process and know what results would mean if they were normal or abnormal and get to choose up front if that testing is right for them. But that's not always the case. Not every OB/GYN out there has access to a genetic counselor. And in this case example, this patient had testing with her OB and then was only referred to us after receiving those results. And in this case, her results did come back abnormal, meaning her blood test indicated an increased chance to have a child with Down syndrome. Specifically, her blood test indicated that there was out of a 1 in 50 or 2% chance. So part of the counseling is educating the patient on what does that risk mean. The way you phrase that risk can have different feelings to it. So 1 in 50 versus 2% versus 98% chance baby does not have Down syndrome. So really having that conversation with the patient about what her result actually means. We then also would discuss the significant limitations of the type of blood test that this patient had and whether it would be important for the patient to explore this risk further by doing any other type of testing. We would review the pros and cons of learning about a diagnosis of Down syndrome prenatally. For example, would it help the patient be able to prepare emotionally, financially, mentally, or would it cause way more stress and anxiety than provide any of that benefit? So we have an emotional conversation as well as have the more clinical conversation. And so we would also talk about her options. So we can either just use ultrasound, which can give us some information. A normal ultrasound would reduce but not eliminate the risk. Abnormal ultrasound would increase that chance. We could do another more accurate blood test that again could either significantly reduce or increase her risk, or consider a diagnostic procedure that could definitively diagnose or rule out one of these conditions. So after reviewing all the pros and cons, a patient decides what makes the most sense for them. And in this case, the patient elected to have an amniocentesis procedure, in which case we were able to officially diagnose Down syndrome for her pregnancy. So once we know that it is a definitive real diagnosis, then we have a further conversation and talk about what does that mean? What is it like to have a child with Down syndrome or raise a child with Down syndrome? What resources are available? And how is this diagnosis going to impact the family? We also talk about her options. So either continuing the pregnancy, choosing to put up the child for adoption, or consider ending the pregnancy based on these results. In this case, the patient elected continue and then use this information really to help prepare herself and her family members for the arrival of this baby. And in this case, because we know baby has Down syndrome, we can also help best shape her and baby's care for the duration of the pregnancy.
And our last case that we'll present is a case from the pediatric clinic. So a clinic where children are seen for genetic indications. This particular patient was a 4-year-old boy. You can see on the right-hand side is a pedigree or drawing of the family history. He's at the bottom left there. He came to clinic because he had short stature, developmental delays. He was not walking and talking on time, and he had an insatiable appetite. So the parents also remarked that he was floppy as a baby. He had weaker muscle tone. So the geneticist and genetic counselor works together to see this patient, take a family history, evaluate him physically, and the geneticist and genetic counselor suspected a particular diagnosis and were able to counsel the family about their testing options for this specific condition. And the specific condition that they were concerned about is Prader-Willi syndrome. So in the world of genetics, it's not all that uncommon, but in the larger scheme of things, it is a rare genetic condition. Most cases of this condition are sporadic, meaning they happen just brand new in a baby and are not passed down in the family. There is recommended treatment that cannot cure the condition, but help reduce some of those symptoms and effects on the child's health and development. One of those is growth hormone therapy. So there's very specific genetic testing that's indicated. This genetic testing is not a conventional type of test. This is not an easy condition to diagnose with testing. So common forms of testing may not completely assess for this condition. And so this is where a genetic counselor comes in handy, because a genetic counselor would have the training and the expertise to know exactly what type of test is needed to diagnose this child. And so the parents elected to proceed with testing, which did indeed reveal that this boy had Prader-Willi syndrome, and then from there on he was able to receive the treatment that he needed and have an idea of, or really have an answer of what was causing these health problems for him. So with that, we wanted to give you a little bit of information about Genetic Counselor Awareness Day. This will be the third year that there's a Genetic Counselor Awareness Day. It will be next month, November 14th. This is a national day that recognizes and celebrates genetic counselors. Texas genetic counselors always get together to do exciting things to raise awareness. For example, 2 years ago, we had a scavenger hunt competition, and last year we raised awareness through a social media-based bingo competition. And we have exciting plans for this coming year. So we'll do our part, and you do yours to spread awareness of genetic counseling on November 14th. And we also wanted to leave you with a few resources before we move to our Q&A portion. The National Society of Genetic Counselors, we've mentioned several times. The Find a Genetic Counselor feature may be helpful to you as you look for shadowing opportunities and opportunities to chat with genetic counselors. If you're here in Texas, the Texas Society of Genetic Counseling is also a great resource for you. And then NSGC has a specific page focused on interested students. Again, you're more than welcome to take a look at the program websites for the two programs here in Texas, the UT Houston program and the Baylor College of Medicine program. The American Board of Genetic Counseling and the Accreditation Council for Genetic Counseling are two very important organizations for us. The American Board of Genetic Counseling is what offers the board exam and administers it, and then ACGC, the second item, is the accrediting board that tells us who has which programs have accreditation and have met the standards to be genetic counseling programs. And with that, we'd like to use our last 12 minutes or so to answer some of the wonderful questions that you all submitted both during registration and currently live during the webinar. If you have other questions that you'd like to submit, please, as Amber mentioned, submit them in the questions tab. We are going to try to get to as many as we can. If we're not able to get to all of them, you're welcome to contact us later on. So the first question that we wanted to ask is, what do you think are some of the reasons why genetic counselors report such a high job satisfaction?
So I can go ahead and answer that one. You know, I think there's a lot of things that go into that. So most genetic counselors, they enter the field because they wanted something that combined their passion for genetics and helping people. And so I think the fact that we get to work with people on a daily basis we get to be advocates for patients. I think that's one of the things. I think some of the other things are, it is a very competitive salary, so that's important when you think about being able to support yourself. And then I just think the variety that comes with the job, you can work in so many different specialties. You can be involved in research. You can switch specialties throughout your career. There's flexibility. Some people, may work from home. Others may commute to work. They may have positions where they can do both. So I just think there's a lot of things that lead genetic counselors to having a high job satisfaction. Megan, do you have anything to add, or Sarah?
Yeah, I'll add that on a very practical level, it is a true 9-to-5 position. So there's very rarely ever a time where I need to take my work home for me. Sometimes the emotional toll of certain cases can follow us home, but in general, when we're at work, and we're at home, which is important for me in keeping that work-life balance. I think it is also a very supportive community. Many genetic counselors are like-minded individuals and support and love one another in ways that I don't see across other types of professions. And so I think everyone is generally understanding and in favor of self-care and your own mental health, which I think is really important.
Absolutely. I think I agree that the hours and the culture really contribute to the high job satisfaction. And another thing that I think is really great about genetic counseling is the life learning aspect. I think that if I were in a profession where I was doing the same thing every day, I would tend to get bored. And so the fact that genetics is changing constantly, I feel every week I need to read a new article or learn a new genetic test that's an option for my patients. So the life learning aspect of genetic counseling has been really great for me as well. There are a few questions specific to asking about genetic counseling programs and the application process. So one question is, are gap years common? Megan, did you want to answer that question?
Sure. Yeah, so very common. I would say it's actually maybe even a 50-50 split between students who come straight out of undergrad into graduate school, and then other students who may have one or even more years in between undergraduate and grad school. We have multiple students who tried out other professions and found us later on in life who finally got their way into genetic counseling. We have others that just wanted to take a year off and do other things before getting back into school. So I would say it's more common than you might think.
Absolutely. How do you know which program is right for you? I'll start with addressing this question. I think one thing about having the ACGC accrediting board and right now having a small but really exploding profession is that all of the genetic counseling programs are outstanding because the accreditation requirements are very, very, very high. So all genetic counseling programs are fantastic in preparing you to pass the board exam and to be an exemplary genetic counselor. So the ability of the program to prepare you is not as much a concern, but different programs definitely do have different personalities. It can be hard to judge those personalities based on the program websites. So I think that something that is helpful is reaching out to a particular program that you're interested in, attending an information session if you're able to, and speaking with the current students, and then absolutely, if you do receive an interview invitation, I think you have a really great idea of the culture and the focuses of the programs once you're able to meet with someone in person. Did y'all have anything to add to that?
No, that sounds great.
Okay, great. Someone else was asking for any advice for personal statements on applications.
Yeah, I have advice. So through my role of the coordinator of recruitment and outreach, one thing that I often do is respond to emails from past applicants who were not either granted an interview or acceptance for a cycle and just want some feedback on their application. So I've gone back and read quite a number of personal statements and things like that to provide some of that advice. And one thing that's really struck me is I'm missing the why. Most people will explain that they want to be a genetic counselor because they want to help people, which is certainly an important component. But to us, that's not necessarily a compelling component. So one thing that we really do like to hear about is why genetic counseling specifically. And so that bit of a nuance, I think, could really help a personal statement stand out above the masses.
That's fantastic advice. Another question is, how have the ethics regarding genetic counseling changed over time? So I'd like to answer this one. I teach the ethics course at the Baylor Genetic Counseling Program, which is really one of my passions. I love talking about ethics and genetics. One thing about ethics and genetic counseling is that it changes incredibly quickly. So, for example, in 2013, we were talking about whether genes can be patented, and there was a Supreme Court case that said genes cannot be patented. And now, in this past year, we've started really talking about practical uses of gene editing and whether that's ethical and how that can be implemented, as that's become a reality much quicker than I think most of us in the genetics community had expected. So you can count on ethics being a rapidly changing force in the genetic counseling field. It's always exciting and important to have genetic counselors as advocates in the ethics field. Another great and I think really interesting question is, what intersections between genetic counseling and social justice issues have you experienced in your career?
I think one of the things that I have definitely noticed is kind of related to the access of genetic counseling. So I work at a large medical center, and Texas is a big state, and it tends to be the main cities, so Dallas, Houston, San Antonio, Austin, that tend to have the genetic counselors. So I think people that live in more rural areas can have more trouble with access. Definitely when we think about coverage for genetic testing and who has insurance, whether or not they can get genetic testing or the cost of genetic testing. So I think there's barriers that definitely come up in that realm. And then if you have, a genetic mutation and you need specific changes to management or preventative care for those individuals that maybe don't have health insurance, that can pose some difficulties as well. So those are just, a few kind of broad areas where I've kind of seen that intersection.
Great. Another important question is, what is the hardest part about genetic counseling in terms of the emotional toll, and how do you deal with that?
Sorry, Sarah, if you want to go ahead.
You got it, Megan.
Okay, so working as a prenatal genetic counselor, I would say in general, most moms come into their pregnancy excited and hopeful for the future. And oftentimes when I'm seeing them, it's because of something terrible and it's the worst news they've received, and those expectations they had for the future of their child are completely altered. And so it can be quite traumatic for my patients on certain days. And so there are some cases that do follow me home where, it's just so unfair to think about the struggles that some of my patients go through, or some of those access issues that Amber was mentioning, just some patients who really, really need a service and just cannot get it. So I think the most helpful thing is just having a support group, whether that be other genetic counselors who really do understand what you're talking about and what you're going through, or, other support people in your life to just take that time to vent and then focus on some element of self-care. Because one thing that is really important is, you have to be the best version of yourself in order to help someone else. And if your emotional or empathy tank is low, you're not going to be of service to someone else. So just having those support people outside of that session, I think is really helpful.
Absolutely. And we'll wrap up with our last question. What is the most fulfilling aspect of the job? I could talk about this for hours because I really love what I do, but to kind of tag along with what Megan was saying, one of the most fulfilling aspects for me, whether I'm working in prenatal or in cancer, is getting to help someone through what might be the most difficult part of one of the most difficult times in their lives, helping them understand very complex information, making it digestible for them, and helping them make decisions based on that information is just incredibly fulfilling for me.
Yeah, I definitely agree with that. I think the fact that we get to be an advocate for our patients and honestly just the gratitude that my patients express, you know, having someone that takes the time to talk with them, to listen to them, to explain the information, it's just extremely rewarding to work with those individuals and to have, you know, such an impact on their life and really hopefully make this experience a very positive experience for them.
Yeah, and I agree. I would say another part that is really fulfilling to me is being fortunate enough in Houston, we have a really large genetic counseling community here. And so I just love the other elements of my job that I get to participate in. So being active in a genetic counseling program and working with students and just having many different avenues of job satisfaction.
With that, we are at our time, so this will conclude our webinar. Please look out for a feedback survey that will be coming to you shortly after we end the webinar. We're very glad that you all were able to join us tonight, and thank you for participating. We hope to see you sometime as a genetic counselor in the future.
Yeah, and if you do have additional questions, I know that there were several questions that we were unfortunately just not able to answer. So feel free to, you know, send us an email. You know, you can find all of us on the www.nsgc.org, find genetic counselor, and definitely feel free to reach out to us if you have any specific questions that you'd like answered. All right, thanks everyone.